Hello and welcome back to my channel of Simplified Psychopathology. This is Ritvik Sharma, your host. So we were discussing cognitive behavioral therapy in my last video, and we were discussing about goals in cognitive behavioral therapy. Today, the topic is cognitive distortions. So we will talk about cognitive distortions and cognitive behavioral therapy. What are cognitive distortions and how we can work upon cognitive distortions and how we can use this therapy to help our clients. Okay. So what is cognitive distortions? We will talk about it and we will talk about types of cognitive distortion. So cognitive distortion is basically a distorted thought or cognitive distortion. Are there many is an exaggerated pattern of thought. Like if you're having anxiety and you're thinking about something and like you're thinking about you are going to fail an exam again. And if you're not able to properly work on that, properly revise everything, and you're revising it again and again, again and again, and then you're not able to understand that you will be able to pass the exam. And then these kinds of thoughts are cognitive distortion. Or you're in a new relationship and there's a past trauma which happened, like there was a bad relationship which you have, the partner was toxic, so you're meeting new people, and then you will think about that the other person, if the other person is nice as well, if the other person is good as well, you will think about that the other person will also abandon you, or other person will also leave you. These types of cognitive distortion can happen. Like if sometimes we exaggerate what kinds of thoughts are on your mind. Like if something is going on in your, like you exaggerate, like there is some kind of problems in your body, and you like a pain or something, and you exaggerate it to a bigger disease or something, or a bigger illness or something. That kind of cognitive distortions are there. And cognitive distortions are also the distortions, like you are jumping on the conclusion before doing the attempt as well. Like if you're trying to give an exam, you will jump on the conclusion that I will fail. So that can be the reason that these are the thoughts which you're having in cognitive distortions. Okay. So in other words, cognitive distortions are your mind convincing you to believe negative things about yourself and your world that are not necessarily true. Like if somebody has left you in your relationship, you will think that everybody will leave me, and that will become a core belief. Or if somebody is having abandonment issues, the other person will think that this person will think that the other person will leave him as the last person left him. So these kinds of thoughts are what is cognitive distortions. Okay, our thoughts, and these thoughts affect your mind, and then can create anxiety, and then can create depression as well, and other mental illnesses. Okay, so our thoughts have a great impact on how we feel and how we have behaved. When you treats these negative thoughts as fact, you may see yourself and act in way based on faulty assumption. You create faulty assumption about the negative thoughts or about the things which are going on in your mind, and then according to that your feelings, your behavior changes, and then anxiety and depression develops. Okay, everyone falls into cognitive distortion on an occasion. हर किसी के साथ होता है. It can be because of a trauma, a past relationship, or anything, and you will get into cognitive distortion. It can later on fix, or it can be on in the cognitive distortions. That happens particularly when we are feeling down. So that is what the thing is. When we are feeling down, when we are in depression, when we are in what you can say in a sad state or something, and then you will feel like that. But if you engage too frequently in negative thoughts, your mental health will take a hit. आप cognitive distortions में बार बार जाएंगे और negative thoughts में बार बार सोचेंगे, तो आपका mental जो health है वो will take a hit. So let's talk about what types of cognitive distortions are. So we have filtering, and mental filtering is draining and straining all positives in a situation and instead dwelling on its negatives. Okay, like we have given an exam and we got our results, and on all the subjects we got good marks, but in one subject we didn't get the good marks. So mental filtering is a cognitive distortion. We will take out all negatives, and we will do all the positives till there. So that kind of person is perfectionist will, and going through this cognitive distortion, and it can degrade what kind of you are having. And these cognitive distortions can have problems. And like if the example is like good time at company, and your compliments or hard work several times. And then in the end, they make an focus on that improvement suggestion only. You will not focus on the performance review time, the hard work which he has appraised. Because of that, he praised you several times. So you will just be feel miserable and dwell on that suggestion of improvement. That kind of mental frame is a cognitive disorder as well. So let's talk. So it's polarized or nothing thinking. Like we can say, polarized thinking is thinking about yourself and the world in all or nothing way. When you engage in thoughts of black and white with some gray, this type of cognitive distortion is leading. Like you will only about black and white. Okay. You eat a sandwich. Now you cannot stand or go to be in your last test, fail at being a good student despite getting only A's before that. Like if you're getting A's again and again in an exam, and you're sometimes you got B, you will think about it, why this is happening to me, and that kind of thinking is a polarized thinking. It can happen to anyone. Sometimes your performance will lag down. Sometimes your performance will it will not be up to the top, up to the mark, and then you will be getting a B. A black and or white thoughts may also set up to failure, and that can cause anxiety, and that can also cause depression problems. This is what polarized or non or all or nothing thinking. Okay, so and there's another negative the cognitive distortion, that is overgeneralization. When you overgeneralize something, you take an isolated negative event and turn it into never-ending pattern of lose and defeat. Sometimes what happens when you overgeneralize the thing, I understand people generalize the thing these days, but you don't need to overgeneralize every other thing, and you have to leave every other thing. So you will ruin your chances of understanding what kind of chances you're getting, and you can work on these chances and you can work upon it. But if you overgeneralize every other thing, you will not be able to work your chances, and you will ruin your chances, and you will not be able to achieve what you wanted to do. So you can see, you speak up at a team meeting and your suggestions are not included in the project. You will leave the meeting thinking, I'm ruined my chances for a promotion. I never say the right thing. So that is what the thing is. It can happen that sometimes your sometimes your suggestions will not be taken. Sometimes in your life, your relationship will not work and your things will not work. That is what the cognitive distortion, and we will see the like we are facing problems and we are having issues. So these are the things like we overgeneralize the thing. So that is what the thing is, which is overgeneralization. That is a cognitive distortion. And then we comes up with discounting the positive. In this kind of, it is also a mental filtering in which we remove the positive thoughts and then we work upon only the negative things, and we give value only to the negative aspects, what is going on in that situation. So if someone compliments the way you look today, you think they are just being nice. So if you're complimenting you about your hair, about your like your shirt, and like you will only think about like they are just being nice, you're not looking good. So that kind of thinking, that can be bad thinking. So that is what the thing is. So the if your boss tells you how comprehensive your report is or something, and you will also think about that your boss is being nice to you. Your boss is a nice man, but you will not think about yourself that you have done a nice job. So this is also a kind of cognitive distortion. Okay, so we have discussed today what are cognitive distortion, what is overgeneralization, what is polarized or all or none thinking, and what is mental filtering, and we also talked about discounting the positive. So in my next video, we will talk about other cognitive distortions and how we can help and work upon these cognitive distortions. Thank you.